Hi, I'm Dan. I'll be the PCL today. Before we break off to do bedside shift report, let's talk about how we can make this high-risk time safer for our patients. We'll be adding COAST to bedside shift report. COAST stands for Code Status, Oxygen, Access, Safety and Tubes and Drains. By ensuring that all of these areas are covered, we will have better communication amongst all team members and improved outcomes for our patients. Going over your patient's code status is an essential part of any report. You need to be able to communicate this information in order to prevent patient harm or a delay in care in the case of an emergency. Making it a habit to visualize the no CPR band on your patient when you first walk into their room is a great way to ensure that nothing is missed. Let's take a look at the following scene.
Barbara is an 86-year-old female. Her code status is Do Not Resuscitate. Sounds great. Hi, Barbara.
Did you see anything in that scene that could potentially lead to patient harm? Verifying what kind and how much oxygen your patient is receiving will ensure that your report matches what is currently going on with your patient. Let's watch the next scene to see an example of how miscommunication can lead to patient harm.
Richard is on continuous BiPAP for acute respiratory failure. Respiratory called me earlier to let me know that the settings were changed to 12/8.
His oxygen saturation is 86%. I'll verify that the settings are correct. His BiPAP settings are 10/5. This needs to be corrected right away.
How could things have gone differently if the oxygen settings were not verified? Your patient's IV access is important to ensure that the venous access is still working properly and there is no patient injury. The 5 rites of medication administration should also be completed during this time.
My arm is really hurting and swollen where my IV is.
Let's take a look.
It looks like his IV has infiltrated.
How could the patient have been harmed if the venous access was not assessed during shift report? Ensuring your patient's safety is an essential part of your shift report. Verify that alarms are activated, fall precautions are in place and that the environment is safe for your patient.
Let's go meet Ronald in 61206. He came in with a fall at home.
Sounds great. Where did Ronald go?
He must have gone into the bathroom. He's been getting up so frequently I must have forgotten to set the bed alarm.
I don't feel so good.
Oh no, Ronald.
How could Ronald's fall have been prevented? During shift report, you should be verifying that any person with tubes or drains has the proper setup and supplies at bedside. Ensuring that the insertion sites and dressings are clean and changed per policy will prevent delays in care and potential infection. The indication for an indwelling Foley catheter should also be given in report, as well as the plan for removal.
Janet has an indwelling catheter. Catheter care was last completed an hour ago.
Do you know the indication or plan for removal?
No, that wasn't communicated by the last shift.
How does having a clear indication and removal plan help to improve patient outcomes? Let's take a look at the next scene. Pay attention to how the reporting nurse uses the COAST algorithm and how it reflects onto her patient.
Cheryl is an 82-year-old female. Her code status is Do Not Resuscitate. She was previously on 2 liters nasal cannula but has since been weaned to room air. There is normal saline running in a 20-gauge peripheral IV in her right hand at a rate of 75 milliliters per hour. The IV works great and has good blood return. She ambulates to the bathroom using a cane. Cheryl has an indwelling catheter. It was inserted 3 days ago for acute urinary retention. The plan is for her to go home with the catheter in place and follow up as an outpatient for avoiding trial in 2 weeks.
I can see that her no CPR and fall wristbands are in place. Her IV access is working well and the pump is set up properly. I also verified that the Foley catheter is flowing freely and is free of kinks. Her chair alarm is activated and she has her call button within reach. I'll be back within the hour with your medications, Cheryl. Please let me know if you need anything in the meantime.
It was great taking care of you, Cheryl.
Did you notice how the report that was given went smoothly and communicated essential information? Bringing Coast into your bedside shift report will not only improve patient outcomes, but it will also improve nurse satisfaction. Don't forget to Coast.